welcome again to Rate 301 Sectional Anatomy. We're going to each week have several, or at least one or more lectures, with the exception of perhaps the last week or two when you'll be reviewing for the final. And each week we'll cover different areas of the human body, and we'll cover those in cross-section. Be that axial, sagittal, or coronal, you'll be able to see images in all three planes. And we're going to start with the body organization and just review terminology that you need to be familiar with for the duration of the class. So for this first week, there are several pages here in the beginning that will just give you a list of terminology that you need to be aware of. And you're welcome to print these out and make your own notes if that's helpful for you. But this is a list of things that you should know by the end of the first week. And we're going to start by going over the body cavities. So there are two main cavities, sections of cavities here in the human body. The dorsal cavity, which is the area here, the cranial cavity in the vertebral body. The cranial cavity, of course, contains the brain, and the vertebral cavity also contains the spinal cord. So that is a dorsal cavity. Dorsal referring to the back or posterior portion of the body. And then the ventral body cavity is the portion in the front here, where the anterior portion of the body. The thoracic cavity, which also contains the mediastinum, and the pleural cavity here, the lungs, and the pericardial cavity surrounding the heart. And then you have the abdominal cavity, which contains all of your abdominal organs, and the pelvic cavity, which contains the pelvic organs. And we will go over all of that in upcoming lectures, but just so you get to be familiar with that terminology. And there is peritoneum that covers most of the organs in the abdominal area, and there are a few organs that are not covered by this peritoneum. They're called retroperitoneal structures here in this last line, and those particular structures include the pancreas, kidney, duodenum, ascending and descending colon, aorta, and the IVC. So those are structures outside of the peritoneum. They are not covered by peritoneum, and those are structures that you should be aware of. There is a language to anatomy and sectional anatomy that allows you to describe the relationship between one structure and another, or the position of a structure to its surrounding structures. And we're going to go over the language now. The anatomical position, and different anatomy classes have different specifics in how you want to describe anatomical position. And so for this class specifically, it would be the feet flat on the floor, your arms down by your sides, palms facing forward, and the head facing forward. So some of the pictures are going to show the toes pointed down as if the person is sort of suspended in space and they can point their toes past vertical or past horizontal. But for this class, it would be as if you were standing on the floor. And I think there's another slide that actually will describe that. But when we're going over these other positions and descriptions, we're using that image. So when we're talking about superior, we're talking about towards the head. So if you say the ears are superior to the shoulders, that is correct. So anything that is towards the head from another structure is superior. Inferior is towards the feet. If you're talking about anterior, that's toward the front side or the ventral side of the body. If you're talking about posterior, it's toward the back side or dorsal side of the body. Medial can be midline of a structure or the body. So if you're saying that the torso is medial from the arms, or you might say that the belly button is medial to the hip bone. So it just depends on what particular structure you're talking about. You might be talking about the liver and a medial portion of the liver itself versus one body part to another. Lateral is away from the midline of the body or structure. Proximal is towards the origin of a structure. So it might be closer to the body itself, but it depends again on whether you're talking about an organ or a specific bone in the body or a ligament versus one body part to another. Distal is moving further away from the center of the structure or the origin of the structure. So it's towards the end of the structure um, or part of the body. Superficial is towards the surface. So the skin is more superficial than the bones. And deep is towards the center of a structure or the body. We'll talk about that a lot when we talk about muscles. And peripheral is also towards the edge of a structure or the body. So superficial and peripheral are similar, but there are slight differences, and we'll probably talk about those a little bit as we talk about anatomy specifically. So now we're going to talk about body planes, the planes that we use to image a patient. You should be able to identify its image by its body section and its plane as well. The anatomic position again is the patient facing you, feet flat, palms facing forward with their arms at their sides. And when you view the cross-sectional images, for the sagittal and the coronal, it may be computer dependent on how you see that image, whether it is facing for a sagittal, whether it's facing left or right. But generally, the posterior side is on your right and the anterior side is on your left. For example, if we're imaging the spine, you would see the posterior side of the spine on your right and the anterior side on your left. But again, that could be manufacturer specific. Coronal will almost always be the patient's left on your right and vice versa. So when you're looking at an image, you are looking at it as if the patient is facing you. Transverse is a little bit trickier. It is viewed as if their left is on your right, but the patient is lying on their back. So the posterior side is on the bottom of your screen, and the anterior side is at the top of your screen. Their left is on your right side, and their right is on your left side. So it is as if the patient is lying on their back, and you're looking at their feet and looking at the image from the foot toward the head. So that one gets a little bit tricky, but we'll go over that when we look at axial images. So once again, the sagittal divides a body structure left or right, body or structure left or right, and a midline sagittal divides that body or specific body part down the center. So this is a midline sagittal right here. It's dividing the body exactly in half, right and left. An axial divides a body into superior and inferior portions, and the coronal divides the body into anterior and posterior portions. We talked about the three imaging planes, sagittal, axial, and coronal. There's also oblique, which means at an angle. So over here on the right, when you're looking at the angle, this is a traditional direct axial slice through the ankle. But you might want to get an angled slice, an axial oblique, so then you would tilt the slices so that they match the plane of the foot. That would be an axial oblique. Same thing with a coronal. This is direct coronal axial or direct coronal slices through the ankle. And if you were looking at the foot, though, you might want to get a coronal oblique. And this also will help you understand short axis and long axis. So in order to visualize the longer bones in the ankle, you would want to do a coronal. And this would give you the long axis of the ankle, whereas this would give you, the axial would give you the short axis of the ankle. Same thing here with the foot. The coronal of the foot, and this is where it becomes really important to understand how somebody is describing anatomical position, because if the feet are flat, it's going to be different than if the feet are pointed down. So with the feet flat, your coronal oblique will give you the short axis of the foot and the foot bones here, but the axial oblique will give you the long axis of the bones of the foot. Probably the easiest piece of anatomy that I can think of to describe a long axis and a short axis is the thigh bone. When you look at the thigh bone directly as if the patient's facing you, which is the most common way for us to look at the hip bone, especially like on a radiograph, either that view, the coronal view, or the sagittal view will give you the long axis of that bone. You will see the most of that bone that you can in a sagittal or coronal plane. But if you do the short axis of the bone and you want to see multiple components of that bone, you would do an axial, and you will get multiple slices through that body part to see the whole thing. You will have to do that on a coronal or a sagittal as well, but you'll see the majority of the bone in one image versus just little pieces of it at a time. Same thing with the kidney. Sometimes a long axis of the kidney could be either a sagittal or a coronal, but the short axis would be an axial. Orthogonal is direct axial, coronal, or sagittal planes. So I'm going to go back just for a moment to this. This is direct sagittal, coronal, or axial planes. They are not oblique at all. So this would be orthogonal planes, whereas any of these angled slices would not be orthogonal. They would be oblique.